You're listening to the Monday Night Community Show with Daniel on BRFM.
And we're firstly going to be talking to Donna and Paul. They're going to be telling us all about a patient participation group. And we're first joined with Donna. Donna, thank you very much for speaking to us this evening.
Thank you. Hello, Daniel.
Hello. Now, I was wondering, perhaps, to start us off, if you could tell us a little bit or an introduction into your surgery.
Okay, well, I'm the practice manager at Saffron Way Health Centre in Sittingbourne. At the moment, the surgery is based in porter cabins. They're very nice, well, we're supposed to call them modular buildings, actually. They're very nice. They were put there in 2008 to replace some rather grotty old ones. And we are hoping by the end of next year to be moving into a new building. We're just keeping our fingers crossed and hoping all the planning application goes through okay, which is in at the moment. We've got 3 full-time doctors, a couple of practice nurses and a healthcare assistant. A healthcare assistant is somebody who is not quite a nurse but is trained in certain areas that traditionally nurses would have worked in, so like taking blood, doing health checks, ear syringing, that sort of thing.
Now, I was wondering, perhaps, if you could tell us a little bit about your role at the surgery as well.
Okay, well, I'm the practice manager, as I said, and my job is to manage just about everything. I have to be a bit of a jack of all trades. So I manage the day-to-day running of the surgery, I manage the staff, I manage the finances, I handle any complaints that come in. I'm the first point of contact for the surgery, and but also sometimes if people are off sick, I have to actually do reception sometimes or answer the phone or whatever.
Now I'm going to talk to Paul. Paul, good evening.
Hello, Daniel.
Hello. Now, I was wondering first if you could tell us a little bit about your role.
Well, my role within the patient participation group is really, I've just finished a stint as being chairman. It's now been passed over to somebody else to do. But the group itself is really just a group of volunteers that have got an interest in the patient experience. We actually, as a group, get a good insight into how the surgery works. Now, we meet every 6 to 8 weeks, 60 minutes minimum, 90 minutes maximum really, and that's really going at a push, always in the evening, and the aim is really to work with the surgery staff to help us provide as good a service as we can, or help them provide as good a service as they can from a patient's perspective. It's always valuable for the surgery to have feedback, and other opinions help them to keep on improving. At the moment, there's 13 of us. We are looking for more people to come along, perhaps 7 more. And it's fair to say, really, that the age of the patient participation group members is around about 50. So really, we're looking for younger people to come on board if we can.
So how can you join the patient participation group, Paul?
Well, actually, that's actually pretty easy. I mean, if you know a member of the group, you simply talk to them, and then you can come along to one of our meetings, or you can email Donna, which you can get her email address via the link on the surgery website, or you can email the group email address. Or if you go to the surgery, you can actually just talk to the receptionist and ask about joining, and they'll probably pass you over to Donna or give you a form to fill in. And also what we're looking for at the moment actually is for quite a few people, if we can get them, they've got to be Saffron Way Health Centre patients, of course, is to join a virtual patient participation group.
Now, Paul touched upon it a little bit, the virtual patient participation group. Donna, I was wondering if you could tell us a bit more.
Yes, well, more and more we're being encouraged to take on board the views of our patients because it's now not so much about what the doctors want to do to the patients, it's about what the patients' needs are, and we also want to provide as good a service as we possibly can. As Paul said, you do have to be a member, a patient at Saffron Way in order to join one of our groups, but most doctors' surgeries now have patient participation groups and virtual groups. So if you get in touch with your own surgery, if you are interested, I'm sure they'd be more than happy to hear from you. But a virtual group, we recognise that not everybody can come out regularly to meetings, and also there are some things where we just need to get as many patients' opinions as we can, as quickly as we can. So a virtual group is one where you put forward your email address to me. I do nothing with that email address other than use it for the purpose of the virtual group. And if we do want to get canvas opinion, if we're thinking of bringing in a new system, or if we have a questionnaire that the patient group wants to put out there, then the virtual group gives us an opportunity to just fire off emails to the people in that group, asking them to just reply. You can join that by actually going to our website, which I know you're putting on your Facebook link, but it's very easy. It's just www.saffronwayhealthcentre.co.uk, and there's actually a link on there that you can click on to join the virtual patient group, and that will then come to me. I'll get an email with your email address on.
So what are the surgery specialisms?
Well, our particular surgery, we do all the normal sort of clinics for people with things like diabetes and asthma that are nurse-led. We also have one of our doctors does minor surgery, removing lumps and bumps. We have an anticoagulation clinic, which is anybody that takes a drug called warfarin has to have their blood levels monitored regularly, and that's a service that actually we offer to patients from other surgeries that don't run that service. And then we do things like phlebotomy, which is taking blood samples, child health and childhood immunisations, travel immunisations, all the general stuff really.
Now, before you go, I know you wanted to cover a little bit about raising awareness via YouTube, Paul.
Yes, if we can, please. Nowadays, a lot of companies sort of use YouTube. They have their own TV account, and as a group, we decided that we'd like to set one up. So we've actually set one up, but it's not quite live yet. And as a test run for this, we actually did a recent video, and I asked some of my friends if they would get involved in this. They were quite willing to do it, and gave them carte blanche to talk about what they wanted to. And nearly every single one of them talked about the appointment systems at their surgeries. So when we do our first one, Donna's been very gracious, and she's allowing us to film her first. And guess what? We're going to talk about an appointment system. The only thing that we've got to worry about is we just got to make sure that Donna's had her hair done first, before we do it. Now hopefully we'll have that live in around about 4 weeks' time, and the link to that will be on the surgery website. Now, some of the other subjects that we're keen to cover is a member of the group actually is involved in the Peggy Wood Clinic, which is the breast centre at Maidstone. We've also got a patient and partner who's willing to talk about prostate disease, because with that type of disease, although men get the disease, it does affect the whole family. And also talk about bowel cancer as well. And one of the main things that we're really looking for is for the patients at the centre to tell us really what they want us to video, what they want to know. And if they want to know how a prescription is done, and it may sound odd, then we'll do a video. And it's what people want, and that's good. And also, I'm pleased to say that in today's world, as a group, we've actually managed to get a little bit of sponsorship. A company called Thirst for Knowledge Events Limited are going to fund us 3 years so that we can actually take forward some informative educational events. Now, we're not too sure where we're going to go with that one yet, but we've got the funding in place for that, which is really good. Now, if you wanted to talk to us and give us some ideas about what you wanted for the videos to be, I'll give you the web address again, which is www.saffronwayhealthcentre.co.uk. And if you didn't want to go through that, but you wanted to email us as a group, we've actually got an email address, which is swhcppg@btinternet.com.
Paul and Don, I'd like to thank you both very much for coming along and telling us all about the group.
Thank you very much.
So that was Paul and Donna telling us all about the patient participation group at the Saffron Way Health Centre in Sittingbourne here at BRFM.